Hello, this is Dr. Rich Blake speaking to you from San Francisco, California. I hope you're all safe and your families are safe from this virus. I want to talk to you about the indications for using the inverted orthotic technique in your normal practices. The basic rule is that when somebody has an everted heel, as in this example, say from a flexible flat foot in a child or an adult acquired flat foot, where the heels are everted to the ground, the goal is to make an orthotic that centers those feet more under the legs in a more vertical position. I use a 5-to-1 rule when I'm making my orthotics. Therefore, if I measure the heel position as being 7 degrees everted to the ground, then I'm going to use a 35-degree inverted technique. And that has tended to work over the years. The second reason we use it is for a little bit more or less common situation. It's in a patient who has a high degree of tibial varum and rear foot varus, where some of these patients actually, when they pronate, the calcaneus does not actually make it down to vertical. And it makes no sense to make an orthotic device that holds them around a vertical position. So I tend to use at least a 25-degree cant in my inverted orthotics, which would be a 5-degree varus cant, to help take these patients with the sort of partially compensated rear foot varus out of their maximally pronated position. And the third reason, which I've used over the years, and this is showing a right foot from the back, is what we call running limb varus. A lot of runners, as they run fast, tend to land on the lateral side of their foot, and then they have a rapid pronation to get the heel to the ground. And that is called running limb varus, because they can have normal biomechanics but still pronate to excessively, so that the tibial to calcaneal angle is going to be quite excessive. And again, the standard orthotic is about 25 degrees, which would be a 5-degree varus cant, but a lot of these patients will need 30 and 35-degree cants just to get their pronation slowed down enough to take care of their running pronation problems. So I hope this gives you some indication of why we use inverted orthotics. And I appreciate the honor of being able to give you this talk.